To say that there's one best treatment for cervical stenosis is probably not a valid point. So there are many different treatment options that someone can consider when someone presents with symptomatic cervical stenosis. First off, you can consider non-operative treatments, things like physical therapy, oral medications such as non-steroidal anti-inflammatory medications, and then various injections. It really depends on what the patient is presenting with. If it's more neurological based, and by neurological based, what we're referring to is complaints that radiate to the extremities, whether it's pain, numbness, or weakness. If these neurological symptoms are progressing over time, we're more apt to recommend surgery. Is there one best treatment alternative? The answer is no. I think all of them have to be considered based on the patient's presentation, based on the patient's complaints, based on their imaging, and what the surgeon is comfortable doing. And from that, we formulate a more definitive surgical plan that's best for that specific patient. So all patients should be considered from a unique perspective. But if we looked at the various surgical options to treat cervical stenosis, you can come from the front of the neck or from behind the neck. Anterior is from the front, posterior is from the back. If we come from the front of the neck, we're obligated to do a fusion, where we go ahead and link bones together with a metal plate, screws, and then put in bone grafting material to get that part of the spine to heal as a solid block. If you go from the back of the neck, you can do a non-fusion operation or a fusion operation. You have a choice. And again, how we decide which is the best approach is based on what the patient wants, what their primary complaints are, and what the radiographic imaging shows.